Respiratory assessment. This video is designed to assist you in developing your understanding of the 4 stages of respiratory assessment: inspection, palpation, percussion, auscultation. Indications. Respiratory assessment is done as part of a physical examination prior to and following anesthesia when subjective or objective symptoms indicate a change in a patient's condition. Changes in respiratory function are the most sensitive indicator of an impending adverse event. Prior to performing the assessment, ensure you have all the necessary equipment at hand: stethoscope, watch or clock with a second hand, alcohol swab, observation chart, and progress notes. Taking a respiratory history and explaining the procedure.
Good morning, Katerina.
Hello.
How are you?
Good, yeah.
I'm Kate. I'll be the nurse looking after you today.
Hi.
I'll just have a look through your notes. We'll have a bit of a history.
Okay.
All right then. So Katerina, how old are you?
I'm 34.
34, lovely. Yeah. Have you ever been to hospital with any breathing problems at all?
Yeah, I had asthma from a very young age, so I've been to hospital.
Okay, yeah. So when was your last attack? Within the last 3 months at all?
No, not for years.
Okay, great, yeah. And how's your asthma managed?
I take a...
When taking a respiratory history, consider the following points: smoking history, respiratory illnesses, medication, hospitalisation.
Now lately, have you had like a runny nose or a cough at all?
Yeah, I've had a cold in the last week.
Okay, fine. Yep. And what colour has your sputum been?
Just normal, sort of.
When taking the history, make sure you not only listen to your patient, but also look at them. What colour are they?
Not too bad.
What position are they in?
Tight, but
Are they talking in full sentences?
bearable.
Remember, hand hygiene should always be performed before touching a patient.
I'll take a respiratory assessment off you. Okay, so I'll just kind of look at you, and what I'll basically have to do is have to kind of draw down your top. Okay, then I'll get you to sit up, and then I'll feel your skin, and then we'll have a listen.
Okay.
All right, if that's all right.
Sure.
Stage 1. Inspection.
Good. Yep. Right. Yeah. And so just as I'm looking at you now, I'm just going to feel your pulse. Okay, so I just want you to concentrate on your breathing, and then this will take about a minute or so as I feel your pulse and your breathing.
Look for signs of increased work of breathing, such as accessory muscle use, pursed lips, and diaphoresis.
That's good. Keep going.
After taking the pulse rate, inspect the patient's rate, rhythm, and depth of respirations over the course of a minute.
Yeah, just kind of breathe normally for me.
Look for symmetrical breathing by standing at the side or at the foot of the bed. Stage 2. Palpation. Remember to conduct each stage of the assessment in a systematic sequence to ensure all lung areas are assessed. Progress in a zigzag motion, from side to side and from top to bottom. Be sure to assess the anterior, the posterior, and the lateral chest wall.
What I'm doing, I'm just feeling your chest. Now tell me at any stage, is there any discomfort or any pain? That feel okay?
Yeah.
Yep. I'll get you to sit forward and I'll do the same to your back.
Check for any lumps and bumps and any abnormal bony structures. Note the patient's skin temperature and moisture.
Just slightly come back and you can stay in that position. Is that comfortable?
Yeah.
Yep, that's good. Yeah. So what I'll now get you to do is that I'll get you to repeat the words 99, 99.
99, 99.
Yep, one more time.
99, 99.
Great. I'll just do the back. Yep.
99, 99.
That's good.
99, 99.
Just one more time.
99, 99.
Okay, that's great. I'm going to put my hands around your chest and just take a nice deep breath in for me. And out. That's good. One more time. I'm just looking for the nice rise and fall of your chest. That's good. I'll do it to your back. Okay, big breath in. Yep. and out. One more time. That's good. You've got good, nice rise and fall. All right, then. That's great. Okay, you can just lay down there slightly.
Stage 3. Percussion. Percussion produces audible sounds and palpable vibrations, which can help determine if the underlying lung tissue is filled with fluid, air, or solid material. The types of sounds you can expect are resonant, in the case of healthy lung tissue, hyperresonant when too much air is present, as in emphysema or pneumothorax, and dull, when there is abnormal density in the lungs, as in pneumonia, pleural effusion, or tumour. Note how the nurse percusses by striking her finger close to the nail in the interspaces of the ribs.
That's good. I'll just do it under your arm there. Nice and comfortable. Just breathe normally.
Stage 4. Auscultation. The types of normal breath sounds you might hear are bronchial, which are high and loud and are heard over the trachea and larynx, bronchovesicular, which are moderate in pitch and heard over the major bronchi where fewer alveoli are located, and vesicular, low and soft, and heard over the peripheral lung fields where air flows through smaller bronchioles and alveoli. Abnormal or adventitious sounds may be heard over normal breath sounds. The types of abnormal or adventitious sounds you might hear are wheezes, which occur in the case of asthma and emphysema, when air is squeezed or compressed through narrow passageways, crackles, which occur in the case of pneumonia or pulmonary edema, when inhaled air collides with previously deflated airways, which then suddenly pop open, and rhonchi, which occur in bronchitis and are due to airway obstruction creating a low-pitched wheeze. When there are decreased or absent breath sounds, this may indicate obstruction by secretions or mucus. Ensure you cleanse the stethoscope with an alcohol wipe to reduce the risk of transmission of infections.
So what I'll get you to do is that I'll get you to breathe in and out through your mouth.
The key to effective respiratory auscultation is to listen to the intensity, pitch, and duration of the inspiratory and expiratory sounds throughout the cycle.
Okay, that's good. Now listen to your back. Yep. A bit bigger breaths. That's great, that's better.
Ensure that you always compare left to right lung fields and avoid listening over bony parts.
That's good. Just 2 more times. That's good.
Remember, hand hygiene should always be performed after touching a patient.
I'll just write down some findings.
Documenting your findings. Ensure that normal and/or abnormal findings have been documented in the patient's progress notes and that you have completed their observation chart. Notify your senior nurse or medical officer if concerned.